This time, I'm going to talk a little bit more specifically about benevolent touch, what it is, the different types, and the guidelines for using it. Benevolent touch is a simple, caring, relaxing routine that can be easily implemented by you to your client. It can improve sleep patterns, it can increase relaxation, and it can make your communication much more efficient. By definition, benevolent touch is a positive, tactile contact on another or one's own skin with loving intent. So I'm going to break that up and say that again. It's a positive, so it is an attitude, and it's a tactile contact to another or one's own, so benevolent touch can be self-care, self-nurturing, and it's done with loving intent. So it's a gentle, caring touch. The theory behind benevolent touch is that even though the mind is deteriorating, the body, often still healthy, remembers. The body, a lot of times, is the most effective communication tool for older adults. Their sense of touch is their memory. Now, I'll give you an example of how that works. When you walk into the room, your client, depending on what their mind level is, they may not remember your face or your name, but if you go up to them and give them a nice, loving hand massage, they may all of a sudden say, "Oh, you're the one with the cold hands." So they will remember who you are by your sense of touch to them. And that's very important to keep in mind. There are three types of benevolent touch. The first type is unstructured benevolent touch. These are ways of touching that you're all familiar with. As caring, nurturing healthcare professionals, you are all doing unstructured benevolent touch already. By hugging, by giving a handshake, by putting your arm around someone, by just resting your hand on someone's shoulder, by patting someone on the back, or just with sitting with them and listening to some nice, soothing music. These type of touches are spontaneous, and it's a positive contact that suits the immediate situation. Okay, they are the most natural form of human expression. The second type of benevolent touch is a structured benevolent touch, which consists of steps for you to do a massage or relaxation techniques. So the structured benevolent touch would include the hand and facial massage, breathing exercises, slow stroking, back massage, and foot massage. You should always allow plenty of time to do a structured benevolent touch massage, because it can be very relaxing to sore muscles, and actually a back massage can help with the total well-being of the client's body. When these techniques are completed properly, a good massage can be invigorating, and it can be one of the greatest delights of life. The third type of benevolent touch is traditional benevolent touch. This includes gestures and tasks where you have to touch someone in order to complete the task. Some of the main examples would be activities of daily living, when you help to feed someone or to bathe someone, when you're helping someone get dressed or you're helping to toilet someone. You need to touch them in order to do those activities. So if you can use a caring and gentle, benevolent attitude when doing that, it will make the process so much easier for that client. Also, some other traditional benevolent touch would be petting of animals, dancing, and taking people's blood pressure. Those are all traditional benevolent touch. So just to review, there were the unstructured benevolent touch, which would include handshaking, holding hands, arm around your shoulder. There's the structured benevolent touch, which would include the steps to doing a back massage or a hand massage or a facial massage. And finally, the traditional benevolent touch would include the activities of daily living, as well as other tasks where you need to touch someone in order to complete the task. The guidelines for benevolent touch are very simple, yet very important. Number one, know your client. You want to make sure that you ask how they're feeling when getting their massage or their benevolent touch. And if they can't verbally tell you, you want to be able to watch their body language and their non-verbal cues. The body will tell you to either move on, continue doing the massage, or back off and get to know that person a little better. Number two, you need to ask permission. Before touching anyone, you need to look them in the face, get some good eye contact, and ask, would it be all right if I give you a hand massage? Or, how would you like a hug this morning? And then use your good judgment to respond to those answers. And the third guideline with benevolent touch would be you, the caregiver, need to be centered. The art of centering is quieting yourself, both physically and mentally. You need to let go of any exterior distractions and things going on in your life because you need to focus on helping your client. We all need to